Welcome to Developing an Organizational Rhythm. I am Mara Bryant. I'm the Operations Executive at Adventist Health White Memorial. When I reflect about the journey that we've had utilizing the Malcolm Baldrige framework, I realize there's some key foundational structures and learnings that have helped us become the organization we are today. One of those is understanding what our core competencies really were and utilizing those core competencies to differentiate ourselves in our market. That is a huge piece of who we are. And when we reflected upon ourselves, we were really about serving the underserved. We are an inner city hospital. 95% of our patients are government funded. It really created in us a need to be able to be efficient, effective, focus in on essentialism, and really leverage those key characteristics that we had. The other really important piece of functioning in the inner city is really realizing that you're not in it alone. One of our other core competencies is a mission-driven partnership with the East LA community. It can be daunting to think about providing care to 5 million people who are immediately around your hospital. But when you think about it, that you're not in it alone, and that you have key partners in the community that will help you be successful, that will work with you, and where you have weaknesses, they have positives, we're able to synergistically work together. So when we talked about developing an organizational rhythm, thinking about those core competencies that I just reflected on, it was important for us to understand how we were going to execute reliably, systematically every single month, every single year, year after year. And that's how we talked about being deliberate on creating an infrastructure for governance. It was that accountability, holding ourselves accountable at our frontline levels, at our middle line levels, all the way up to the governing board. And having the different forums where the leadership team for the hospital and the governing board members meet together and collectively determine what is best for this community that really leverages, like I talked about, those core competencies, and it built in a cadence to the organization that reflected every single month. So we would cascade our results through our structure, really from the bottom up to the board, and we needed to understand our results. We needed to have answers that we were held accountable at all the different forums. And also, a key learning that we had through our Baldrige journey is that everything needed to be aligned. It needed to line up with our strategic planning process. Our process needed to be strong, that it was identifying those things that are really the key leverage points. Once those were identified, then it was easy to make decisions about what other projects we may or may not do. The other thing that became very evident is we needed to have participation at all levels. And for instance, we had our strategy day. Every year we have strategy day where we go off-site, we bring together all the key leadership of our community board, our philanthropy board, our key partners, all of our internal leadership, our shared governance structure, all sit down together. And we learn together. So we would have challenging presenters talk about the future of healthcare, give us different insights about what the future may hold. And then we would sit there and look at our draft strategy map and say, what makes sense? Where are we missing? Do we have any blind spots? We would break out into small groups where we would go over the detail on the map and really making sure that we had seen and vetted through every single one of our strategic initiatives. And we had that chance to talk back and forth. Then we would cascade down to what we called Quality Day. It was really our launch point for any new projects pulling out in that calendar year. Usually it would happen in January. We would decide on which projects we wanted to launch at Quality Day. Again, we coupled it with learning. We would bring in outside speakers, focusing on new topics. I can tell you the last 3 years of Quality Day have really been about understanding to reach beyond our walls, that we're no longer just a hospital, but we are a health company. And that means that our job doesn't end at the curb where we put the patient into their car. And we would work on projects around those kind of key concepts in a great setting where everybody, again, for innovation, isn't in their normal workspace. They're out in a totally different workspace where they can think creatively, they can interact with people that they wouldn't normally get a chance to. And then we would capture all that key learning into what we called Quality at a Glance. And this is a document we produce every single year. It talks about, in plain English, every single project and key indicator, why it's important, what our historical numbers are, what we're shooting for in terms of targets, and then really became the guiding document, especially for our community board members and our non-clinical staff in the hospital, because it put it in terms of just plain English, not medicalese. And then, rolling that through, as we would develop and cascade down that approach into our Organizational Performance Council structure that we've talked about, really important that we would take those big concepts, and then the individual teams of our structure, our 8 working councils, are responsible for certain projects. And they are scheduled to meet every single month. They know their measures. They can measure their performance against it. We produce all that centrally back out to them so that they're able to look at it and know exactly what they have to focus in on. They are also raising up issues to the Organizational Performance Council each month that need barrier resolution, or we talked about it in previous things where if we feel like there's too much energy going out in the organization, we may need to dial some stuff down in changing the business. But all of this kind of developed into that rhythm. And then really specifically, when we talk about the performance improvement rhythm, it's a week-by-week thing for us. So every week is focused on a different activity, and there's different results that flow out. And as long as everything stays in sync, it rolls beautifully. So we're really very deliberate. We moved most of our data collection tasks into a weekly type of a task. In the old days, when we finished February, it would be the end of March before we'd have our results. Now, February ends. By the end of that first week, we have the preliminary results for all of our measures. So you're able to take what used to be a 3-week process, condense it down to 1 week. You can start action planning then earlier in the month and move improvement faster. Week 2 was really about giving that data back to the owners. And we have a weekly, actually today, when I'm recording this is one of the things we're doing today. We sit down as a team and we go over the preliminary numbers and say, okay, does it make sense? Does that seem realistic? Given the day-to-day numbers that we look at, now we're looking at a monthly number, do they all line up? This is an interesting trend. We need to break down the data more. So we're able to give the owners of the different teams a really specific set of data that they now can do action on. So, they get to review their data, then they sit down with their councils in week 3, able to have very substantive conversations and create really good action plans around those. And then those action plans are rolled in and talked about at Organizational Performance Council, and then lastly communicated out throughout the organization so that everybody knows for the next 30 days exactly what we're going to be focused on. And we have very focused presentations around, these are the key 4 things, these are the key 6 things that we're working on for the next 30 days. And then we take that information into this leadership talking points document. So every month, along with the numbers, there comes the leader talking points. And that way we know that the key messages are getting out to all layers of the organization. It's a kind of a cheat sheet for non-clinical people to be able to explain some of the clinical indicators, or to finance people who need to talk about customer experience. So it really helps all of that piece. And our president always has a message along that talking document. So we're just constantly being able to keep everybody in the loop. We are keeping people understanding where we're going, and everybody's focused and aligned. Those are the key structures of our organizational rhythm. And for us, it really is about being a servant leader, and that servant leaders are servants first. It begins with that natural feeling that one wants to serve, then you serve. It's a conscious choice that we all choose to aspire to lead. And one of the ways that we lead is by creating that alignment, that communication, and that rhythm. Thank you.